Well, many of us are feeling the strain of working from home and had to make, I should say, changes to our daily routines. And for some of us, dealing with the loss of someone to coronavirus or any illness right now is extremely difficult. Joining us right now is Dr. Mo Gelbart. He's with the Thelma McMillan Recovery Center. Doctor, thank you for joining us. There are a lot of people stuck at home right now. They're alone. What impact does that have on the brain, and what can people without any human interaction do to improve their mental health?
Well, first of all, let me just correct. I'm the director of practice development and community psychiatry with our main offices and with our corporate office in Sacramento.
You're the perfect person we want to talk to you about these questions.
So yes, I think the key factor, which you've heard, I believe, many times, social distancing and does not mean social isolation. And staying at home and quarantining oneself and not being able to get out amongst friends and family and so on doesn't mean we can't stay connected. And being able to stay connected is really the key. Of course, in this situation, there's tremendous challenges. Kids are not going to school, families are staying home. People are spending more time with each other than they've ever spent before. And although that in many ways is beneficial and pleasant, it's also quite challenging.
Yeah, you mentioned that there are people who are stuck at home with other people, and sometimes you don't want to be at home with those people. And specifically, there are some people who are stuck at home with others that they are in an abusive relationship, for example, and there's not enough space. And a lot of these people look forward to leaving the house, and now that they're not able to do that, what can these people do?
Well, it's very difficult, but again, I think the main thing is reaching out to friends, family, with the platforms that are available, whether it's online, telephone, primarily those, and making sure you're staying connected and not holding up and completely isolating. But you're absolutely correct. The incidence of abuse is increasing. And I guess like anything, when you're in the house, not able to go out, whatever issues are going on in one's relationship are going to be magnified.
And finally, Doctor, really quickly, a lot of us know people who have lost someone, whether it's to the coronavirus or another illness. What can we do to process this grief that we're experiencing, even though funerals aren't even being held right now? That's usually where we would get the support, through our family and friends, through these meetings, through the funeral. What can we do now?
Yeah, that's a great point, because this is like something we've never experienced before. And as you said, funerals and services, memorial services, allow us to provide closure. And without those being available, without the ability to remember somebody fondly and so on, we're left with this sort of hanging feeling that, the grief is just tremendously intensified. And again, the key in most of these situations is, expressing rather than repressing. In other words, making sure you find the outlets for communicating, finding people you can speak to, and making sure that you honor and respect your own emotions and your own feelings, and have the opportunity somehow to discuss it with those people who care about you. The one last thing, the other piece of the puzzle with grief and family members dying, traditionally, if somebody's in the hospital and critically ill, the family is there. The family's around the bedside. The family's the last person holding that person's hand. In this situation, that's not available. And, the physician or the nurse is on the phone with the family member, but we can't even see our loved ones as they go through that pain. And that is tremendously painful for people.
And what's important to know is that there are organizations and other help that we can get to. Dr. Gelbart, thank you for your time. Thank you for joining us and answering some of these questions a lot of people at home are wondering about. We appreciate that. Meanwhile, if you're in need of other emotional support, you can also use the crisis text line, and that number is there on your screen. You can text the word HOME to 741-741.